Hi, is your child short? So let's see in this video what could be the reasons for short stature. So the common causes of short stature is, first thing, familial short stature. Here, if you or your parents are short, then your child is inevitably going to be around the same height as you or your parents. This is called as familial short stature. Second is constitutional delay in growth and puberty. What this means? This means that if you or your parents had a delayed puberty, that is late menses starting around 16 years of age, or delayed onset of mustache and beard in case of boys, then your child also will have delayed puberty. So they will have the puberty related growth spurt also later in age. So this could mean that they will appear shorter compared to their peers now, but they will have a later growth spurt and they will reach a normal adult height. So these are the two common causes of short stature which I see in my OP on a regular basis. So the other causes which could be there are systemic diseases. Suppose the child has a heart disease, a lung disease, or something related to the gut or kidney or liver problem, then a lot of energy is being used in these conditions. Hence the height and weight gets compromised. Once we treat the systemic disease, then their height and weight automatically improves. The next group of condition which could cause short stature is skeletal dysplasia. So skeletal dysplasia means the bone formation itself is at fault. So the children will be short right from the birth and they will grow at a very slow rate. The next disorder is called as rickets. Here the body needs calcium and phosphorus at adequate levels to maintain the bone health. In case the calcium and phosphorus is low in the body for some reason or the other, then the bones become weak and tend to bend. This is called as rickets. So once we treat these children, the legs can become straight and the child's height also will improve. The next group of condition is called as hormonal disorders. So in hormonal disorders, the common catchy point is that they will be short and fat. So this is a catchy point that we have to suspect hormone disorders. The four common hormone disorders are growth hormone deficiency, hypothyroidism, hypoparathyroidism and Cushing's syndrome. So the next group of condition is called as genetic disorders. In genetic disorders, there are a lot of syndromes which we say as Down syndrome, Turner syndrome, Russell-Silver and so on. In these group of conditions, how we diagnose is that the child will have some facial abnormalities, or the child will have some congenital malformations of the heart, of the lung, or some hernias. They will have some manifestation which will make the doctor think of syndromic features, and hence a genetic test will be ordered and the genetic diagnosis will be made out. Here there are some options to improve the height of the children which the doctor will discuss with you once the diagnosis is made. The other cause is if the child is on medications such as steroids which can hamper the growth rate of the child, then the child will appear short compared to the peers. So once the steroids are stopped, they will grow at a better rate. So these are the common causes of short stature.